Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
No one wants to get cancer or undergo its treatments. What if we could prevent cancer from ever developing in the first place? Mission Evolution Radio TV show is coming to you around the world on the Voice of Canada Broadcast Network, www.vocbn.ca. With us this hour to explore cancer prevention is Dr. NALINI CHILKOV. Dr. CHILKOV is an Oriental medical doctor and leading authority on integrative cancer care and immune enhancement. She's the creator of the Outsmart Cancer system and author of 32 Ways to Outsmart Cancer: How to Create a Body in Which Cancer Cannot Thrive. Her website, outsmartcancer.com. Dr. CHILKOV, thank you so much for joining us on Mission Evolution.
Thank you so much for having me.
It's just a real pleasure. This is a pretty doggone important topic. Seems like cancer is growing in numbers of cases. Is that your perception as well?
Absolutely. In both the United States and Canada, 1 in 2 people will be diagnosed with cancer in their lifetime. So think about sitting at a dinner party, half the people.
Oh my goodness. Oh my goodness. Yeah. Well, we'll get into why you think that is. But first, what is an Oriental medical doctor?
My license in California, where I practice, allows me to be a primary care provider. And that means I can perform all of the services that your primary care doctor can provide. And at the same time, I am trained in Chinese medicine, which is really the very first naturopathic medicine and natural medicine.
How does Oriental medicine differ from Western medicine?
Oriental medicine is based on the map of nature and asking how are we out of balance and how do we restore and return to balance. And there is traditional Chinese medicine, and there is also modern Chinese medicine, which is based on research and science. And this is a map of looking at the whole body and how we either are in harmony with nature and are healthy, or we are out of harmony with nature and we have illness.
I love that, because if we're ever out of harmony, now we're starting to see why we have all the cancer, right?
Yes.
Um, so, how does the education that's required to become an Oriental medicine doctor compare to an MD?
Well, in California, we take all the same pre-med undergraduate that anyone preparing for medical school would take. And then we are trained in the theory and practice of Chinese medicine, which includes a lot of the same practices and views as an internal medicine doctor, but using the tools of acupuncture and Chinese herbal medicine as our primary tools. However, my practice is very modern medical practice, and so I combine the best of modern medicine with traditional and modern Chinese medicine.
That sounds like a good way to go. I've heard that Western medicine was based on study of cadavers, while um, Oriental medicine was not. Is that so? And if so, what effect does that have on the two practices?
Well, actually, that's not really true because the Chinese actually did dissection and knew anatomy. They didn't have modern labs or microscopes, but they did dissect the body and look at what healthy people when they die, what they look like, and what people with disease had going on internally. So certainly having a cadaver teaches you things nothing else could teach you. But really, Chinese medicine is a very deep and sophisticated form of medicine and interfaces beautifully with modern medicine.
Do the meridians and chakras and all that fun stuff play into Chinese medicine? Oriental medicine, I'm sorry.
Yes. So when we think about Chinese medicine, we're looking at not only the physical body, but we're also looking at the energy body. And this is looking at how energy moves and flows. And this is fundamental to the traditional lens of Chinese medicine. However, when we're sitting as a physician, sitting before a patient, we use all our powers of observation. And in traditional early Western medicine, the same things were looked at. You want to look at the presentation of the patient, the sound of their voice, the smell of their body, the color of their skin, the temperature. All those same things are common to all traditions of medicine.
Do you, when you're working with Oriental medicine, do you really refine your senses to be able to pick up all that?
I would say that the way that traditional doctors are trained relies so much more heavily on our perceptions and our skill of observation compared to modern docs who do come to my clinic and observe. They really rely on technology, and they've somehow lost some of their sensitivity and their ability to really perceive nuance in their patients, I think.
Now I have experienced that. I remember my good old family doc. You go in, and he would sit you on the table, and if you had a problem, he'd palpate.
Yes,
And
yes.
I went to the hospital a couple years ago with a lump in my side and severe pain. And the doctor stuck his head in the hospital door, ordered some tests, and that's as
That
close
was
as he
it.
got to me.
Yes,
That was as
yes,
close as he got to me.
yes.
And of course, they didn't show up on the test. That's helpful.
Well,
So,
I went to a clinic recently because I thought I'd contracted COVID,
mhm.
and they didn't even listen to my lungs.
Oh,
I was like,
yes.
"Are you practicing medicine?" You know?
Oh my. Oh my. So the Oriental medicine, does it still palpate and as well as the other things you said?
Absolutely, and I think that, to do a good assessment of any patient, you must not only listen deeply, observe acutely, but touch and examine your patient.
That's my take, but I'm old-fashioned. I
Yeah,
can't
I'm
make the
old-fashioned
bet.
too.
I just do not
Yeah.
glow in the dark if I don't have to. So, so how do you decide to specialize in cancer care?
Well, everyone has a personal story, I think, and my parents were both diagnosed in their 50s with
Oh
cancer,
my.
and so that meant I was in my 30s at the
Hmm.
time, and so I was new in my professional life, and I, really saw that they did not have the kind of care I wanted them to have. And there was so much missing from what a cancer patient really needs in terms of support and care. And so that kind of spurred me to have interactions with their doctors and to take the resources that I had and bring that to their care. And so my parents were both diagnosed in their 50s, and my dad died at 90 and my mom died at 88, both cancer free. So,
Oh my goodness.
yes,
So you incorporated what you knew from Oriental medicine in their care?
yes.
Oh, that's amazing. So what did you incorporate?
Well, my practice is not only the incorporation of Oriental medicine, but also modern nutrition, modern naturopathic medicine, laboratory studies. So when we think about having a true integrative approach to cancer care, you want to have absolutely the best oncology team you can have because you need disease experts who have access to the latest research and technologies. But then you want to know about what is this body that's hosting cancer? What is this biosystem that is allowing cancer to grow and proliferate and persist? And so we want to look at all of the factors that we could possibly assess. So we want to look at factors like inflammation, levels of vitamin D. So bring in modern laboratory assessments. And then we also use the traditional Chinese lens to look at if the patient is very depleted or very, very congested or has weak digestion and can't get good nutrition, or their detoxification pathways are obstructed. And so we bring in a much broader picture. And we also want to look at what is the environment that the patient is in, and are they exposed to toxins in the environment? Are they in stressful, toxic relationships? And what are all the layers that are affecting a person and their risk and their ability not to resolve the cancer?
So you look at emotional causes as well as the physical ones.
We look at the whole person.
Mm,
Absolutely.
what a concept.
Absolutely.
What a concept.
Mhm.
So what's
Yeah.
your take on why we have are getting so many more cancer patients?
Well, if you look at modern life, we're very disconnected from nature, number one. So we have forgotten what causes health, right? What causes us to maintain and sustain health and to be nourished. So modern life, just the presence of electricity means we're out of sync with our 24-hour cycle, and our physiology is rooted in being in harmony with the cycles of the sun and the moon and our exposure to light. So staying up late and not going to sleep at when it's dark, that disrupts our immunity and our physiology. It disrupts our metabolism. It disrupts our ability to digest and absorb nutrients, our relatively sedentary lifestyles, and I think our emotional and spiritual disconnect are big contributors as well. But the biggest problem is the toxic environment we all live in on planet Earth. And so, if I'm asked what are the top 3 reasons for the prevalence of high rates of cancer, I say environment, 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 because our toxic exposures are really burdening our systems, and therefore our normal physiology is disrupted.
Now, by toxicity, do you include GMOs, that sort of thing that have kind of been taken out of the natural order?
Yes, so genetically modified foods are foods that have been altered to make a plant food resistant to pests. And so this actually affects our gut and our digestive system and our microbiome in profound ways. And having a healthy microbiome is one of the foundations of a healthy immune system. And so all of the things we do in modern life that actually disrupt our gut, antibiotics, pesticides, herbicides, waxes on foods that contain fungicides and herbicides and pesticides, all these things that we're ingesting that are disrupting our normal ecology. The oncologist is fascinated by the disease, by the tumor, but in a health model, rather than just a disease model, we want to have a health model, because what do cancer patients want? They want their health back. They want their life back, not just to be cancer free, but to be healthy. And so we need to be concerned about what causes health. So we have to understand how modern life and modern medicine disrupt our health, and what can we do to move back towards a model of healing and health. And I always ask patients to ask themselves, what causes me to thrive? Because that's a better question than what's wrong.
It's a matter of focus too, isn't it?
Yes, yes.
So it's time for us to take a station break. Dr. Chilov and I will return very shortly, so please don't go away. This is Mission Evolution, www.missionevolution.org. Do we really understand cancer? With us this hour discussing cancer prevention is Dr. Nalini Chilov. Dr. Chilov is the author of 32 Ways to Outsmart Cancer: How to Create a Body in Which Cancer Cannot Thrive. Her website, outsmartcancer.com. Dr. Chilov, we were talking about having a view of what makes us healthy versus what makes us sick, and how does that change our approach to healing?
Well, one of the fundamental things that I say is every cancer patient deserves to have a plan for their health and not just a plan for their disease. Because if you don't have a plan for your health, that's not going to be your outcome. And that's why in cancer care, we don't get healthy people coming out of oncology clinics. So it's completely transformative to be interested and concerned about health. And my wish is that at the moment of diagnosis, the patient has both health experts and disease experts on their team, so that you have a plan right from the beginning, and that you're looking at how to keep the person healthy while they go through challenging treatments, how to help them to recover from their treatments, and then restore and rebuild and sustain their health long term. And so every stage of the cancer journey has its unique needs, whether you've just been diagnosed, which is incredibly stressful, and you need to prepare yourself psychologically and energetically to face whatever solutions you're going to use to get to health after your cancer diagnosis. And then during treatment, you really need your health supported so that you get the very best out of your treatments. Then after your treatments, you want to recover, regain your healthy function back, and then you want to have a long life after cancer. But there's another group of patients who are patients who live with cancer as a long-term chronic illness. And so that set of patients is actually large, and they have a whole nother set of health needs.
How do you as how would an Oriental medicine doctor view cancer and how it's created and how to treat it versus our Western medicine? Because it seems like we have a view of cancer as this beast that suddenly jumps on you for no apparent reason, and you have to fight the devil, right? Um, how does that differ with your Oriental medicine?
Well, in modern medicine, we look at cancer as a proliferative disease where cells are dividing and growing without control. And we understand things about the physiology of cancer and can describe lots of inflammation and congestion and obstruction. And in Chinese medicine, we also use maybe different language and paradigm, but we understand that something is growing without control. We understand that there's heat. So we describe things in Chinese medicine in elemental terms quite often. So there's heat, there's inflammation, there's stagnation, and these are things that are observed by the clinician, but are reflected in modern pathology. So if you're looking at the same disease, you're just describing it with different language. In Chinese medicine, we seek to understand the etiology and the cause of why the person has that imbalance, where in Western medicine, we just look at the disease and rarely ask what caused it. And that's why we don't get to long-term solutions, because we're just sort of looking at the unhealthy leaves at the tip of the branch and that have turned yellow. But what we really want to be concerned about is the root of the tree and the soil it's growing in.
So let's go into inflammation. You mentioned it. Tell us
Mhm.
about cancer and inflammation.
Well, cancer is inherently inflammatory disease. And also, cancer will arise more and will be more at risk for cancer if we have inflammatory diseases. So think about a person who has chronic inflammation in their gut or who has chronic heartburn. So that person would be more at risk for colon cancer or for stomach cancer. A person who has chronic sunburns, the skin's inflamed, is more at risk for skin cancer. And so in this situation, the cells and the genetic material, the DNA, become damaged, and therefore the blueprint and the intelligence of the cell becomes disrupted and cannot correct itself, and has the risk of dividing and dividing and dividing without constraint, whereas a healthy cell will repair damage and then stop growing, stop making new cells. And so in Chinese medicine, we look at this also as a runaway train, and how are we going to restore the normal controls that nature brings to us. And so Chinese medicine is based on the idea that when we are diseased, we've lost our center, and how do we get back to center? How do we get back to balance? So Chinese medicine will describe a disease as excess heat or excess cold, and then the remedy would be a warming herb or a cooling herb or an acupuncture point that would cause movement through an area of stagnation. But this is not different from Western medicine. We just use different language. If we see heat and inflammation, we know we need to do something to resolve that. The toolbox is different, but I have come to think about as a physician that has my feet in both worlds. We're looking at the same patient with the same set of eyes, but we have a different toolbox and a different framework with which to understand our patient. And sometimes one model works better and sometimes another model works better, which is why I believe in an integrative approach, which is take the best of both worlds, so that if a patient is diagnosed with a complex illness like cancer, I want to use modern technology to get a good diagnosis, but then I want to use the lens of natural medicine to understand the nature of the imbalance so that we have a solution for the whole system.
It looks like you're kind of triangulating information by coming from two very different points and
Yeah,
maybe coming up with third options, right?
absolutely.
Yeah. So, isn't inflammation a natural immune response, and how did it become the bad guy?
Well, chronic inflammation is what puts us at risk. A normal, healthy immune system will respond with inflammation to solve a problem. So think about if you get a cut. You'll get inflammation around the sliced open tissue, and that's what brings more blood flow and immune cells to the area. And then when that has been repaired, the inflammation shuts off because the function of inflammation has been fulfilled. However, chronic illnesses of all types, and cancer actually is a chronic metabolic disease. And so if we think of it that way, then we have chronic inflammation that's not shutting off, and that causes damage. It also causes information confusion because all of the biological and energetic processes are signals, right? They're signals. They send information. Something's wrong. Something needs attention here. And so when the inflammation becomes chronic and doesn't turn off, then tissue becomes damaged. And part of that damage can be the wisdom and intelligence of the cells and how we self-regulate, how we solve problems. And so when that goes haywire, we can have biological processes that become out of control. And cancer is a very much an physiology out of control process.
You mentioned that chronic, as I understand it, chronic inflammation can cause damage to the DNA.
Yes. Yes.
Interesting.
So when we have chronic inflammation, what comes with that is what we call oxidative stress or lots of free radicals. And these are little electrons that can bounce around inside the cell and inside the nucleus of the cell, where our genetic material is, and that becomes damaged. And then our master blueprint becomes damaged. And therefore, the wisdom and directives and controls of the cell that keep our biology in harmony and well regulated go haywire. And so a lot of modern life causes inflammation and oxidative stress. So this is one of the reasons that we have more diseases of inflammation and more diseases of bodies not solving problems the way a system in nature would solve them.
The way they were designed originally. Um, so, if you're dealing with, you mentioned something that kind of tweaked my interest,
Mhm.
is the gut. How common is it that the inflammation starts in an imbalance in the gut?
Well, there are certain points of view in modern naturopathic medicine as well as in Chinese medicine historically saying, save the earth, they save the digestive tract, save the gut. That's the first place to start. And if you think about it, if you have poor digestion, an inability to digest your food and absorb nutrients from your food, and your nutritional status is compromised, then you are at a deficit in terms of having all the building blocks for your immune system and healthy tissue. If the microbiome, the ecology of healthy bacteria in the gut is disrupted, which is inherent in modern life, if this is disrupted, then normal immunity is disrupted. Whole body immunity is disrupted. Whole body inflammation control is disrupted. The ability to detoxify and excrete hormones is disrupted. So think about all the cancers that are linked to estrogen driving them, like breast cancer and cervical cancer, and even other cancers like colorectal cancer and lung cancer have lung receptors. So if we can't get rid of our own estrogen efficiently and we have too much estrogen stimulating our cells, we can get a number of cancers. The gut is responsible for a portion of this. And furthermore, the gut is responsible for healthy neurotransmitters and brain function. So these are all self-regulating systems in the body that are reliant upon a healthy microbiome. So it's pretty simple to start to have a healthier microbiome. You can start by eating more plant fibers, just put more plants into your diet, and also by eating a little bit of fermented food every day. And every traditional culture has fermented food. So that would be fermented vegetables like sauerkraut or kimchi, or fermented dairy products like kefir and yogurt. Almost every culture, miso is a fermented product. So almost every culture has some fermented food. You just need like a half a teaspoon a day of something. So these are very simple ways to promote a healthy microbiome. And so there are people in modern life that think parsley is their vegetable, but you actually need, you need about 35, 40 grams of fiber a day to have a healthy microbiome.
So the microbiome is little bugs, right?
The
And
microbiome are our partners in health,
well, that
basically,
too.
yes.
But if what I was going to get at is if we're getting all these pesticides into our system, does it
Mhm.
literally target the microbiome?
It can. It can. As I mentioned before, like a lot of our fruits and vegetables are coated in waxes that have herbicides and pesticides and fungicides on them. So when we eat them, if we don't wash our fruits and vegetables properly, we are actually ingesting those, and they are affecting the populations of bacteria in our gut. But so much of modern medicine also. So for example, a cancer patient who's gone through chemotherapy, not only does the chemotherapy impact the cancer cells, but it infects all of the fast dividing cells, including the little bugs in our microbiome. So when a patient comes to me post chemotherapy, I assume their microbiome needs restoration.
Mhm. Um, I've kind of heard that it's can be difficult once the microbiome is totally compromised to get it back up to snuff. Is that accurate?
Well, I'd say it's challenging, and I think it's the fact of the matter, it could take 6 to 12 months. And so in Western modern medicine, we don't think about a project like that, but actually it is an ecological problem. And so it takes a design of nature to solve it. So the metaphor I often share with patients is, imagine there's a lake that is grown green with algae and no plants can grow in it, no wildlife, no fish are in there. How long would it take that lake to be restored, to be clear and
Well,
clean? It takes
we're
a year, right? At least a year.
we're going
So,
to have to take a station break and pick up on the other side.
all right.
Dr. Chilov and I will be right back to continue our discussion. Please stay right there. Which comes first, cancer or inflammation? This is Mission Evolution, missionevolution.org. With us discussing the ins and outs of cancer is Dr. Nali Chilov. Her website is outsmartcancer.com. Dr. Chilov, we were talking some about inflammation, but is it a vicious cycle? Does, inflammation causes cancer? Does cancer cause inflammation and around we go?
Well, that's really kind of too simplistic, because all complex diseases are multifactorial, meaning there are multiple contributors. So we have, in the presence of inflammation, there is a higher risk for cancer. In the presence of cancer, we have more inflammation. It can be a forward cycle where it's just a loop. So how do you decrease inflammation? One of the most simple ways is to eat a plant-strong diet, because inflammation will be, want to just think about what's an anti-inflammatory diet. So a plant-strong diet, and a diet that is rich in healthy fats and oils like olive oil, avocado oil, nuts and seeds. If your diet is based, your plate has half vegetables on it, and there's olive oil or avocado oil on your vegetables, and you have some nuts and seeds, that's like half of your plate. Then that's going to tip your diet to be more anti-inflammatory, being well hydrated, drinking enough fluid, getting enough sleep, all the things that are just basic foundation contributors that cause health. Those have to be in place if you're going to have health as an outcome, and if you're going to be healthy while you go through a challenging cancer treatment. And those things also cause you to have a healthy microbiome, and so therefore you will be less inflamed due to that. But one of the places to start is just to eat a anti-inflammatory diet.
So, Dr. Chilov, how how important is it to go with organic versus traditional or conventional,
Well,
I guess it's
you
called?
you asked me what I think is causing cancer, and I said toxic exposures. So we want to, what do we have control of? We have control of the foods we choose. And so it is crucial to take control of all exposures of toxins. So not only does eating an organic diet ensure we don't have toxic exposures, and most of the pesticides and herbicides are what we call fat soluble, which means they end up inside our cells and so really disrupt our cellular health and function. But also, when we have organic grown food, it's more nutritious. There's more nutrients in it, and the soil it's grown in is healthier. And so, part of the problem in the modern world with packaged and processed foods, there's not much nutrition in it anymore.
And the foods they used to package and process weren't real nutritious to start out with,
That's right.
probably,
That's
from
right.
what you're saying.
That's right.
Um, so I've heard that you're not what you eat, you're what you ate. I love that one. Is that the case? And if so, what are we looking at with animals, with our beef and
Well, for example, if you eat less red meat, you're going to have less toxic exposures because meat is high up on the food chain. If we eat an animal, they've eaten plants, and then a small animal is eaten by a larger animal, et cetera, et cetera. And so every time that happens, you concentrate more toxins in your tissue. So when we eat animals, we eat a lot of toxins, most of the toxins in the fat. So if we eat more animal fats, we're getting a lot more exposure to the herbicides and pesticides, which are fat soluble. But also remember that our food is raised with hormones now, and so you're getting more hormone exposure. And a lot of the epidemic of cancer is in tissues that are fatty or hormonal. And so the places in our body where we get cancer can be those places that where we store fat. Like, think about the bone marrow is a fatty area, the liver is a fatty area, the brain is a fatty area, all our glands are fatty areas. All of these places are very prone to cancer because they're more disrupted by exposure to fat soluble toxins in the environment and the food chain.
so what can we do? Well, you mentioned what we can do to support gut health, but with what you're telling us here about food and everything else, what would you say are the most important things to focus on? Because there's a lot. What would be the
So
most important things?
So the question is, how do you create a body that will not host cancer? So we've talked about the microbiome, we've talked about inflammation, and we've talked about nutritional status, organic, nutrient dense food. So very important to eat enough protein because this is fundamental to immunity. And as people get older, they tend to eat less protein. And remember that the age demographic for cancer is over 50 for the most part. We're now having epidemics in younger people because of the environment. But historically, most people are over 50. And so people tend not to eat as much protein as they get older. You need about 100 grams, 120 grams of protein a day, which is a lot of protein. So that's 3 or 4 servings of protein a day. So you need a strategy for that. That is crucial to immunity. You need to eat the rainbow. You need to eat a variety of colorful foods from the plant kingdom, fruits and vegetables, because all of those plant pigments are actually talking to your cells and turning genes on and off. That's what we call epigenetics. So that's very important. What else influences our immunity is getting enough sleep. Most people in modern life are proud if they can get by with less sleep, but in fact, 7 to 9 hours of sleep are required for normal immunity. Also, sleeping when it's dark. So I have friends in the entertainment business that go to sleep at 5 in the morning and stay up all night. That will disrupt your immunity. Managing your stress, being in nourishing relationships. And then on top of that, I feel it's really important to take nutritional supplements and herbal supplements. I think it's really, really important to have a good multivitamin, some omega-3, EPA, DHA, fish oils, a good probiotics, or eat fermented food, getting adequate magnesium and bone minerals, calcium as well. And vitamin D is crucial to cancer immunity. So I generally supplement my patients with vitamin D. These are some of the fundamentals. And then there are some herbal medicines that we know interact with over 50 different kinds of signals that impact cancer cell physiology. So things like curcumin, things like green tea, resveratrol. These are things that there's lots and lots of scientific studies, and also the Chinese medicinal mushrooms like reishi mushroom, Ganoderma mushroom. So these fundamental things are the building blocks of health and robust immunity and cancer resistance.
You mentioned protein at length, but I take it you don't mean a big old honking beefsteak on the other side of your plate.
No,
Where,
no.
where, where can we get protein outside of animal protein?
So it doesn't have to be animal protein. So there are some people who are vegetarians who can meet their protein needs, but it's hard to get 100 to 120 grams of protein. I do restrict red meat in my patients because red meat is associated with higher rates of cancer. High animal protein diets are associated with higher rates of cancer. So you want to think about where you can get protein from legumes and beans. That's one source. Tofu is another source if it's not genetically modified. Most of the soy in America is genetically modified, so you have to look for non-GMO soy. Also, dairy products. However, if you have a hormonal cancer, that can be a risk, but I like to recommend fermented dairy products because then we're getting the healthy bacteria as well. Especially yogurt and cottage cheese are really, really healthy. And some of the cheeses like feta cheese and some of the softer cheeses are really healthy and lower in fat. And then non-hormonally raised chicken and turkey, poultry, and also northern water fish. The fish that are from the northern cold waters in the Atlantic and the Pacific are higher in the EPA omega-3 fats, and they're less exposed to toxins.
Also, do you bear in mind you don't want the great big fish that'll be eating a bunch of little fish?
That's right. The smaller fish will, just like the smaller mammals, will have less accumulation of toxins. So swordfish and tuna are some of the most toxic fish that we can eat, whereas mackerel and sardines are much healthier.
So our oceans are under stress as well. Are we getting a lot of pollution there that's being transferred to our wild caught food?
You know, what can we eat today? You know, it's this is the problem of living in a toxic planet. So we can at least say that if we choose fish from northern waters, they'll be less toxic than fish from near the equator. We could say that. And then, of course, you know, it's hard to eat enough protein every single day if you have a busy modern life. So you think about healthy protein powders like whey protein, collagen protein. Those are the healthiest. Also pea protein. These are really great ways. Take a scoop or scoop and a half of protein powder, put in a glass of water in the afternoon and have a protein snack. And there you get 20 grams more protein.
Well, it's a challenge, but I'll bet it can be done.
It can.
So you've developed a particular protocol. Um, um, have you had it scientifically studied? I mean, has it been studied, or are you combining studies to come up with what you're doing?
Well, I think you have to decide if you're going to be a scientist or a caregiver, a clinician, and it's hard to do both full time. So I don't have formal studies, but there are lots and lots of studies of the things that I use in my practice, because if I'm going to give advice to patients and work with oncologists, I have to have good science behind me. So I myself am not a scientist, but there's are lots of studies on many of the things we've talked about today. So I mentioned curcumin, I mentioned Chinese mushrooms. There are lots and lots of studies, and you will even find them in conventional medical journals and in PubMed, which is the resource for scientific literature today. It's a big database. So we're no longer in a time as when I started out in practice. I'm in my 70s now, but when I started, there was no research on herbal medicine or nutritional medicine and cancer, but now there's a lot of research. And so I don't have to do the research. I do labs on all my patients, and I can say, and I can talk to oncologists about why it makes a difference, why I'm recommending something to a patient. And I'm very much into collaborative relationships so that we get the very best for the patient, and that we collaborate together with oncologists and natural medicine doctors so that the patient gets both the best disease care and the best health care. And there's so much that we can do. In natural medicine, we can really manage the side effects of cancer treatments. And there's lots of research. So that's the answer to your research question. I'm not a scientist that does research, but I am a physician scientist that uses research to inform my decisions.
Beautiful. So, so you do read the scientific studies and then make your decisions based on they've come up with.
Yes, because otherwise we're in woo-woo medicine, right? And we have to stand on solid ground. Cancer is a serious illness, and I never want to be guessing. I want to be able to give my patients recommendations that are solid.
Have you found, it used to be when we enter into what they call alternative medicine, that we get a lot of pushback from the conventional people. Are you finding more collaboration going on now? And is it easier?
Well, first of all, I practice in California, and the culture of medicine is different in different parts of the country, in different parts of the world. So I practice in a place where there's a very open-minded medical culture with early adopters of new ideas. And I'm very much a bridge builder, and I think we should all work together and learn from each other and teach each other. And so my whole life's mission has been to have a seat at the table and with the oncologists, and I nurture my relationships with oncologists. I get a huge number of referrals from oncologists. So I think that's the best way to go. We should not be polarized. We should be working together and use all of the resources available to us to help solve a complex illness like cancer.
Amen. And it's time for another station break. Please stay with us as Dr. Chilov and I continue to explore possible hidden aspects of cancer prevention. This is Mission Evolution, www.missionevolution.org. Once a cancer patient, always a cancer patient? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Nali, excuse me, Nali Chilov. Her website, outsmartcancer.com. Dr. Chilov, I know that people that have had cancer, then a lot of them spend the rest of their lives dreading that next test and am I still
Mhm.
cancer free? And what are you seeing as a difference? That can we start alleviating some of that stress for people, or are they pretty much doomed to feel that they're a cancer patient even after they've more or less healed?
Think about the person who has been diagnosed with cancer, which is a shock in and of itself just to be diagnosed, who has gone through chemotherapy, surgery, radiation, maybe hormonal therapy or immunotherapy. And then they come to a point where they've had all this interaction with their doctors and they're told, okay, we're done. We're done. And then that is a moment of high anxiety for the cancer patient because they're like, what? Am I just being dropped off the edge of a cliff and nobody's going to watch over me anymore? And then the fear of recurrence lives with you whenever you're a cancer survivor. It's always there. It's either in the foreground or the background. So the question is, how does it get to be in the background so it doesn't run your life? So cancer itself actually is a systemic whole body illness. It's not just in a location. So once you have a tumor the size of a head of a pin is 3 millimeters. And that means that there's a billion cells there already, the size of a head of a pin. And one of those cells could be a swimmer and travel to some other part of your body. So we always have to have a whole body approach to preventing a recurrence. And what patients don't understand is once that they have had cancer and been treated, there is always a possibility of recurrence because there could be a few microscopic cells left. And most often there are. So then you need a plan to take care of that and take control of it. And that's what oncology does not do. And that's why you need a toolbox to take control of your health and your system after you have had cancer so that you can calm down and not be anxious all the time, knowing that you are being proactive and taking steps to have control over your biosystem. And we call this the cancer terrain. Just like the soil in a garden, the soil that grows healthy cells and healthy plants is different than the soil that grows unhealthy plants and unhealthy cells. So our approach is to have a healthy cancer terrain and understand how to do that. And so the person completing their cancer treatment needs to have the damage from the toxins and the stress of the procedures and the drugs be restored. But then after that, we need to rebuild health and sustain health and create this body where cancer cannot thrive. And so that is the task. And when a patient has that toolbox, then their anxiety goes down because they are taking control and they know that they have research informed recommendations, and they know that they can have an impact on the trajectory of their health and their disease. So that's the Outsmart Cancer system, and it has three main places to start. One is eat a healthy Outsmart Cancer diet. We've described that a bit here. Take nutritional supplements that will produce a healthy cancer terrain. So we mentioned some of those already. And we mentioned protein. Have adequate protein in your diet. So I have a shake that I recommend. But if you start with those three things and then put the lifestyle factors of enough sleep, enough exercise, and interaction with people you love, that's the toolbox. That's where you start. Then if you have a unique type of cancer, or you're living with cancer as a chronic illness, or you have a higher risk of recurrence, then you need other things. But everybody can do what I just said.
What are the other things?
So that is, for me, that's the toolbox of herbal medicine primarily. In naturopathic oncology, we also have some therapies that we use intravenously. So if we need to do something really aggressive, we can. But for example, I like my patients, in addition to the basic nutrition that I've described, to also take a handful of herbal medicines that we know signal the genes which are going to control cancer. And so that's the extra toolbox that I recommend.
So how much is epigenetics involved in becoming cancer proof, if you will?
Well, epigenetics is involved in all the ways we take control of our health. So epigenetics means what are the things you can do to change the genes that are driving your physiology and your health. So if our genetics is our book of life, it's our map of our cells and how they're controlled, then some of those genes are, if they're turned on, that may be cancer promoter genes. We want to turn those off. And we can do that with plant medicine and diet and lifestyle. And we want to turn off the cancer promoter genes and turn on the cancer suppressor genes. That's why it matters what you eat. That's why plant medicine makes a difference.
When you're the other factor that we haven't really discussed that has really increased in the last years is screen time and
Mm,
exposure to EMFs and all of that
mm,
stuff.
mm, mm.
Where does that play in here, or does it?
Well, I think we have to look at all the things in modern life that are disruptors of our health. So, absolutely, being exposed to EMFs is disruptive. There are a subset of patients for whom it's damaging, and in the same way, a person might be allergic to cats. That's not everybody. Another person might have more negative effects to EMFs. So, I think we have to all be concerned about our exposures to EMFs. I actually think screen time, one of the great challenges is the exposure to blue light that's emitted off of a screen actually disrupts our 24-hour biological cycle. So if you have certain phones and screens, you can turn on yellow screen as opposed to a blue screen when it's after sunset. And so you want to do that because then you're not looking at blue light. If you're looking at blue light right before bed, your body thinks it's morning and your sleep cycle will be disrupted. So you can either wear yellow lenses and glasses or make your screen turn yellow. And most laptops and phones and pads have that option. But that's one of the reasons our immunity gets so disrupted in looking at screens. To answer your question, it's not just the EMFs, it's the fact our 24-hour biology is being disrupted, and that disrupts our immunity.
So when they talk about the special glasses that aren't for prescription seeing, but are for working on a computer, that's what you're
Yes.
talking about. They have
Yes,
a filter.
exactly. And they decrease your exposure to blue light. Blue light is the light of morning, and so it confuses your body and your physiology.
So there's nothing wrong with blue light except the timing, right?
Well, it's interesting. If you get up close to sunrise and look at the light without glasses on, near sunrise, you're getting a lot of blue light, you're getting some other parts of the spectrum. And then if you also watch the sunset, those 2 times of the day to be exposed to light actually regulate your mood and your brain function quite a bit. So in fact, there are some psychiatrists who prescribe that to people with mood disorders because it regulates the brain. And so that will also regulate your immunity and your stress response. And we know that regulating our stress response is very important to normal immunity and being able to withstand a surgery or a procedure like radiation or chemotherapy. We need to be resilient. We need to be robust. So we need to take control of all the things we have control over, right? So we can control our screen time. We can control whether we're looking at blue light. We can control whether we go to sleep when it's light or when it's dark. We can control if we're having clean water and organic food. So you just take control of the things you can take control of.
How important is, most of us have gotten so separate from nature, getting our feet in the ground and on actual dirt, being out with the sunshine and the fresh air. Most people don't have much time spent doing that. Do you also recommend nature time?
Absolutely. It's one of the great medicines. I think both you and I live close to nature. And, there's now this whole idea of what called forest bathing, right? You have to be around something green. So if all you can do is go to a nearby park for 20 minutes, at least do that, or go outside and look at the sky, take a walk outside, make a point when you wake up in the morning to go and look at the morning sunlight and stop for a moment when the sun is going down. Go outside, be exposed to that light. Do whatever you can. Get house plants, grow a little hydroponic garden. Anything that we do that is in relationship to nature. I mean, even having a pet, right, is really changes your stress response and your heart rate. And so anything, the map of nature, you can never get lost if you follow the map of nature. So modern life, we're lost. So whenever I feel out of balance, I just go back to nature, because then I have a reference point of some kind of order and sanity and something I can trust.
Do you see nature as being symbiotic? In other words, we've separated ourselves from the very thing that keeps us in balance?
We are nature. We are nature. So this just the language you use, right, shows us how our minds have separated. In the similar way, we say, what's the difference between the body and the mind? They're one thing. I say body mind, right? It's one thing. It's not separate. So we are nature. Therefore, if we observe nature and observe the laws of nature, then we have a better chance of being in harmony rather than disharmony. And so that's the basis of all natural medicine systems, is to observe nature. Chinese medicine was rooted in the Taoist tradition, which is about observing nature. And then as Chinese culture evolved, it became rooted also in Confucianism, which is what is ethical behavior. And so that influenced how medicine was practiced, but also how people lived. And so these are all Chinese cultures about where is harmony? Like, how do you stay in harmony? How do you come into relationship to nature? If in Qigong, which is a Chinese martial art, which we have in medicine, we use Qigong practices to move the energy. The first position is standing. You feel your feet where the human energy meets the earth, and you feel your crown where the human energy meets the heavens, and you take your place between heaven and earth.
Well, we're just about out of time altogether, and I would be remiss if I didn't ask you, Dr. Chilov, what's your mission?
My mission is to change the face of cancer care. I really want people to have a health plan and a disease plan, a health expert and a disease expert on their team. That's my mission.
Well, it's a very worthy one, and bringing back balance and the understanding of how we do have control. I can't thank you enough for that beautiful mission.
Thank you for having me.
It's a real pleasure. Unfortunately, we are out of time. Dr. Chillove and I are done with this discussion. However, the discussion isn't over. I think paying attention to how we can cancer proof ourselves is pretty important. Dr. Chilov is the Oriental medicine doctor and the author of 32 Ways to Outsmart Cancer: How to Create a Body in Which Cancer Cannot Thrive. To find out more about Dr. Chilov, where you can find her book, and all she has to offer, visit her website, outsmartcancer.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, you can always visit our website, www.missionevolution.org. Please be sure to join us right here on the Voice of Canada Broadcast Network, vocbn.ca, where this mission will continue, searching and finding professionals that'll bring the latest information and resources to support you in our evolving world.